Assalamualaikum. Today we start the Salivary Gland, chapter 11. Salivary Gland में क्या क्या पढ़ेंगे? Definition, classification of salivary glands, anatomy of salivary gland, development of salivary glands, structure of salivary glands, histology of major salivary glands, saliva, and clinical considerations. Definition, what is the salivary gland? These are compound tubular exocrine glands found in oral cavity that secrete complex fluid known as saliva. Classification of salivary glands based on size, based on type of secretory cells, exocrine and mesocrine glands. Based on size, two types of glands. Number one is the major salivary gland, and second is the minor salivary gland. Major salivary glands, collection of secretory cells aggregated into large bilaterally paired extraoral glands with extended duct system through which the gland secretions reach the mouth. Three types of the major salivary glands: parotid salivary gland, submandibular gland, and sublingual gland. Minor salivary glands, these are smaller salivary glands confined to the mucous coat of the oral cavity. These glands usually consist of small groups of secretory units opening with short ducts directly into the mouth. The main functions of these glands is not to produce saliva but to secrete minor amounts of saliva onto the mucosal surface to keep the mucosa moist. These include labial glands, buccal glands, palatine glands, glossopalatine glands, glands, and incisive gland. Based on type of secretory cells. बस पहले क्या था मेजर टाइप्स ऑफ salivary gland based on type of secretory cells. Number one is the serous. ये क्या होगा parotid gland. Next mucus submandibular. ठीक है इसमें आपका serous भी होगा और mucus भी होगा दोनों combined होंगे. और थर्ड में क्या है म्यूकस जिसमें आपके माइनर salivary glands. Mucus and mixed glands, these salivary glands which produce a thin watery secretion are called the serous glands, for example, parotid gland. Mucus gland is one which secretes thick viscous substance called as mucus, for example, minor salivary glands. A mixed gland is one which produces both serous and mucus secretions, submandibular. Exocrine and mesocrine glands, when secretory products passes through the cell walls, losing the cytoplasm, it is called as a mesocrine gland. And mesocrine gland, if the secretory product is carried away by the ducts leading from the gland, then that gland is said to be exocrine glands. Endocrine is a term used to classify exocrine glands and their secretions in the study of histology. A cell classified as merocrine if the secretions of that cell are excreted with exocytosis from secretory cells into an epithelial wall duct or ducts and then onto a bodily surface or into the human. Exocrine glands that produce and secrete substances on to an epithelial surface by way of a duct. Examples of exocrine glands include sweat, salivary gland, salivary mammary, venous, lacrimal, sebaceous, and mucus. Exocrine glands are one of two types of glands in the human body, the other being endocrine glands, which secrete their products directly into the bloodstream. The liver and pancreas are both exocrine and endocrine glands. They are exocrine glands because they secrete products bile and pancreatic juice into the gastrointestinal tract through a series of ducts, and endocrine because they secrete other substances directly into the bloodstream. This is the development of salivary gland. Salivary gland की development कैसे होती है? 6 stages हैं. Number one stage bud formation. फर्स्ट स्टेज है इसमें क्या होगी बड फॉर्मेशन. सेकंड में क्या है फॉर्मेशन एंड ग्रोथ ऑफ एपिथेलियल कॉर्ड. एंड थर्ड stage initiation of branching in terminal parts of epithelial cord. And fourth branching of epithelial cord and lobule formation. स्टेज 5 में क्या होगा कैनलाइजेशन हो जाएगी. और स्टेज 6 में क्या होगा साइटो डिफरेंटिएशन. स्टेज 1 बड फॉर्मेशन. फॉर्मेशन कैसे होगी develops as proliferation of oral epithelium into underlying ectomesenchyme condensing around bulb. A thin basal lamina separates the bulb from underlying mesenchyme. Interaction of the epithelium with underlying condensing mesenchyme associated with salivary gland provide optimum environment for gland formation. जो स्टेज 1 है इसमें क्या है अब वो बड फॉर्मेशन होगा. सेकेंड इज द फॉर्मेशन एंड ग्रोथ ऑफ epithelial cord. Proliferation of the epithelial bud into the underlying mesenchyme result in long epithelial cord. The mesenchyme around the developing glandular epithelium also proliferates. Basal lamina is believed to play a role in influencing the morphogenesis and differentiation of the salivary gland. Stage 3 initiation of branching in terminal parts of epithelial cord. Epithelial cord proliferates and its end branches into bulbs. Okay, स्टेज में क्या हो जाएगा कि आपके ब्रांचेस बनना शुरू हो जाएंगी. स्टेज 4 branching of epithelial cord and lobule formation. Terminal ends branch extensively forming numerous bulbs. Gland formation. Ectomesenchyme component deposition within glads apparently serve to establish them. Connective tissue component below epithelial cord forms the capsule and surrounds entire gland. Hypothesis: these epithelial mesenchymal interactions, fibroblast growth factor family, and their receptors transforming growth factor B. Differential contraction of actin filaments at the basal and the apical ends of the epithelial cells. Stage 5 is the canalization. Lumen formation takes place at the distal ends of cord, then the proximal, and at last in central part. Lumen forms within the ducts before they develop within the terminal parts. Apoptosis of centrally located cells. Different rates of proliferation of outer and inner layers of epithelial cord. Secretion of fluid by ductal cells which increases the hydrostatic pressure. Stage 6 cytodifferentiation following human formation in the terminal buds. Epithelial consists of two layers of cells. The cells differentiate into mucous or serous cells depending upon type of specific gland. Some of the outer cells of epithelium differentiate into myoepithelial cells uh, that are present around secretory and base and intercalated ducts. Portion of epithelial bud close to the oral cavity forms main excretory duct. Distal portion forms secretory and pace. As epithelial parenchyma increase in size, connective tissue component around them dimensions and remains as a thin layer. Thicker partition of connective tissue septa continues with the capsule and within which run nerves and blood vessels supplying the gland. Connective tissue septum. Carotid gland photo 6 week of intrauterine life, submandibular 6th week of intrauterine life, sublingual and minor salivary gland 8th week of intrauterine life, majority of secretory and pace during last 2 months of gestation. Secretory component of gland continues to grow postnatally, while as a ductal connective tissue component and vascular component decreases up to 2 years of age. Stages of the development of the salivary gland. First stage is the bud formation. This is the bud formation. Second is the cord formation. That is the branching of cords. ठीक है, पहले में क्या है बड फॉर्मेशन हुई, सेकंड में क्या है कॉर्ड फॉर्मेशन हुई, थर्ड में क्या है ब्रांचिंग ऑफ द कॉर्ड्स, फोर्थ इज द टू फॉर्मेशंस. ठीक है, द फॉर्मेशन एंड फिफ्थ में क्या है कैनलाइजेशन ऑफ कॉर्ड्स. ठीक है, आपके ये ब्रांचेस बनना शुरू हो गई है. दिस वन एंड सिक्स साइटोडिफरेंटिएशन. आपकी जो दिस वन साइटोडिफरेंटिएशन, इसमें आपके जो पार्ट्स हैं जो डक्ट्स हैं वो सेपरेट हो गई है. ठीक है, दिस वन साइटोडिफरेंटिएशन. 6 stages. One is the bud formation, second is the cord formation, third is the branching of the cords, fourth is the loop formation, and fifth is the canalization of cords, and sixth is the cytodifferentiation. Now, salivary glands gross morphology. Anatomy of salivary gland, carotid gland, largest salivary gland, 60 to 65% of total saliva, pyramidal in shape, weights between 14 and 28 gram. MCQs में ये questions पूछे जाते हैं. Superficial portion of gland is located subcutaneously. Subcutaneously in front of the external ear, and deeper portion lies behind the ramus of the mandible. Associate with the facial nerve. Carotid gland. Duct. जो carotid gland है उससे जो saliva जो move करेगा कौन सी duct से करेगा, जो carotid gland की duct है उसका नाम क्या है, Stenson's duct. Run forward across masseter muscle, turns inwards at the interior border of the masseter, and opens at the papilla in oral cavity just opposite second maxillary molar crop. This is the carotid gland. This is the carotid duct. Accessory carotid gland. Carotid gland की duct क्या होगी, Stenson's duct. Once forward across masseter muscle, turns inward at the interior border of the masseter and opens at the papilla in oral cavity just opposite second maxillary molar bronch. 5 centimeter into 3 centimeter. A small portion of parotid forms the accessory gland. This one. Associated with tension duct just interior to the superficial portion of the gland. अब supply क्या होगी? Sensory supply greater auricular and auriculotemporal nerve. Parasympathetic supply glossopharyngeal nerve. Preganglionic fibers synapse in the optic ganglion. Postganglionic fibers enter the gland to the auriculotemporal nerve. Sympathetic supply postganglionic fibers from plexus on external carotid artery or middle meningeal arteries. Vascular supply and lymphatic drainage, arterial supply, external carotid artery, venous drainage, external jugular vein, lymphatic drainage, upper deep cervical lymph nodes. एमसीक्यूज में ये क्वेश्चंस पूछे जाते हैं कि प्रोटेड ग्लैंड की वेस्कुलर सप्लाई या लिम्फेटिक ड्रेनेज क्या है तो इसमें आर्टियल सप्लाई क्या होगी एक्सटर्नल कैरोटिड आर्टरी वेनस ड्रेनेज क्या होगी एक्सटर्नल जुगुलर वेन एंड लिम्फेटिक ड्रेनेज अपर डीप सर्वाइकल लेफ्ट सेकंड इज द सबमैंडिबुलर ग्लैंड 10 to 50 ग्राम साइज क्या होगा 10 to 15 ग्राम 30% of total saliva located at posterior portion of the floor of the mouth. Salivary gland located the posterior portion of floor of the mouth. Medial is aspect of mandible and wrapping around posterior border of the mylohyoid. Submandibular duct. Wharton's duct. सबमैंडिबुलर ग्लैंड की जो डक्ट होगी उसका नेम क्या होगा वॉटन्स डक्ट वॉटन्स डक्ट runs forward and opens into the mouth the tongue lateral to lingual frena the submandibular gland and submandibular duct this is a Wharton's duct आपकी प्रोटेड डक्ट है दिस इज टेंसिस डक्ट दिस इज अ वाटर डक्ट let's dive facial and lingual arteries lymphatic drainage submandibular lymph node and deep cervical lymph nodes nerve supply parasympathetic supply facial nerve reaching gland through the lingual nerve and submandibular ganglion sympathetic supply postganglionic fibers from plexus on facial artery. Sublingual glands are smallest major salivary gland with 2 gram, 2.5% of total saliva, located at the interior part of floor of the mouth, just between mucosa and mylohyoid muscles. This is the sublingual gland. This is the submandibular gland. This is the sublingual gland. Sublingual gland smallest major salivary gland ठीक है ये क्या होगा ट्रिटियम होगा और 2.5% जो है टोटल सलाइवा होगा located at the interior part of floor of the mouth just between mucosa and mylohyoid muscle open into the oral cavity through the series of small ducts of Revenus. सबलिंगुअल ग्लैंड्स की जो डक्ट होगा उसका नाम क्या होगा? डक्ट ऑफ रेविनस. प्रोटेड ग्लैंड क्या क्या था? सेंसस ट्रैक्ट था और मैंडिबुलर का वार्टन था. एंड थर्ड इज द डक्ट ऑफ रेविनस सबलिंगुअल ग्लैंड. Opening along sublingual gland, sublingual fold and open through large duct, Barton's that opens with the mandibular duct at sublingual carinacle. Blood supply sublingual and segmental arteries, lymphatic drainage, mental lymph nodes, nerve supply, parasympathetic supply, facial nerve reaching gland through the lingual nerve, and submandibular ganglion, lymphatic supply, postganglionic fibers from plexus on facial artery. Minus living land are now between 600 and 1000. Just as aggregates of secretory tissue present in submucosa throughout most of the oral cavity, not seen in gingiva and interior part of hard palate. In mucin, antibacterial proteins and secretory immunoglobulins continue slow secreting gland have an important role in protecting and moistening oral mucosa, especially when major salivary glands are mostly inactive. Epineus lingual serous gland located in the tongue and open into the throat, surrounding circumvallate papilla on the dorsum of the tongue and at the foliate papilla on the side of the tongue. Secrete digestive enzymes and proteins that are thought to play a role in taste process. Root of their secretions cleans the throat and preparation that taste recommendations of the stimulus. Which is a structure of salivary. Comprises of the a series of secretory and like base or SNI connected to the oral cavity by a system of ducts. Secretory endocarpes are SNI consist of secretory cells which are arranged in a roughly spherical configuration around the central human art cavity, show a great diversity in size, shape, and cell number. Two types of cells are present, serous cells and mucous cells. Serous cells are protruded and some mandibular gland. Serous cells are also present in formations at the ends of mucous secretory tubules, segmental and glands. Secretions of serous cells are proteinase, usually enzymatic, antimicrobial, calcium binding. ठीक है? जो आपकी secretions होगी serous cells की उसमें क्या होगा? प्रोटीनेस, usually enzymatic, antimicrobial, calcium binding secretions. Secretory endocarps consisting of serous cells are typically spherical and they consist of 8 to 12 cells surrounding the central lumen. Central pyramidal in shape with a broad base adjacent to connective tissue stroma and the apex situated towards the central spherical situated at the basal third of the cell, uh, sometimes the binucleated, sometimes the binucleated. Cytoplasm stains intensely with immunoglobulin and typical cytoplasm is filled with secretory granules, macromolecule components of saliva. Basal cytoplasm contains rough endoplasmic reticulum, which converge towards the Golgi complex. Um, the complex located just apical the lateral to the nucleus. Also contain the cytoskeleton component. The lumen of serous ends base as a small extensions in the form of intercellular canaliculae formed between the adjacent serous cells. So the lumen and intercellular cannuli in serous and pieces. Plasma membrane is several specialization. The surface of the ceramicous cells aligning the central lumen and canculi processes are delicate microvilli that extend into luminal and canalicular spaces. Between basement membrane and the plasma membrane may be engaged by the complex folding 0.5 microns of the basal plasma membrane. Terminates in the form of a classic junction complex tight junction, zona occurrence, and adherent junction, and are desmosomes. Of endoplasmic intercellular secretory droplets, intercellular cancer cross section, the basal folds. Cells are predominant cells type of the salivary gland and most of minor salivary glands. Also occurs a mandibular gland. Secretions consist of large amount of mucin, lubricants, effective aggregations of microorganisms. Secretory component of mucous cells as in consists of found or a tubular configuration, larger lumen, larger than serous cells, pyramidal in shape, broader luminal surface. Pattern nucleus is situated toward its the base. Apical cytoplasm is filled with the mucous secretory droplets. Stains poorly in amatoxylin and eosine. Pus are essential blue positive. Mucous droplets are larger and more irregular in shape. Electron-lucent droplets, more prominent Golgi complex, also contains cytoskeleton components, rough endoplasmic reticulum, mitochondria, lysosomes, and peroxides, but less prominent. Like cell cells, mucous cells are joined by the intercellular junction, lack intercellular canalic. Evidence of tenuously, mucous cells acini may be kept at the blind end by presence of the several cells where secretions reach the lumen of the end passes through the intercellular caniculi between mucous cells at the end of the tubule. serous, this is a nucleus cells. Myoepithelial cells, the name is the basket cells. Contractile cells located around the terminal secretory units and the first portion of the duct system intercalated duct. This located between basal lamina and the secretory are duct cells and are joined by desmosomes, similar to smooth muscle cells. And they are still a spider-like with a flattened nucleus surrounded by a small amount of perinuclear cytoplasm and long branching process that embrace the secretory duct cells. Myoepithelial cells, intercalated duct, the secretory ducts, and basal lamina. The process are filled with the filaments of actin and myosin. Salivary gland immunostate to demonstrate acting in the contractile myoepithelial cells. This is the myoepithelial cells. Again, and has numerous initiation of contraction. Cellular organelles are located in the perinuclear cytoplasm. Only the nuclei is visible in ordinary hematoxylin and eosin section. Bioepithelial cells related to intercalated ducts are more spindle shaped and have few process functions. Of saliva from secretory and base to ductal system. Contraction of myoepithelial cells of secretory ducts may shorten or widen the ducts, helping in maintaining their patency, maintaining cell polarity and the structural integrity of secretory and pulses and base. Produce proteins that have tumor suppressor activity, such as proteinase inhibitors, for example, tissue inhibitors of the metalloproteinases and anti-agenogenesis like this, and that cell may act as effective invasive barrier against epithelial neoplasms. This is the ducts. Three types of the ducts present in the salivary gland. Number one is the intercalated, second is the striated ducts, and third is the terminal. Terminal secretory units opens into a small duct called the intercalated duct. These ducts join to form larger striated ducts, which are finally empty into a larger excretory duct. The system of a salivary gland main excretory duct. This is the main excretory ducts open into the oral cavity. Excretory ducts are mostly located in the intertubular connective tissue. Striated ducts, striated ducts are the main interlobular ductal component. Intercalated ducts, the intercalated duct vary in length and connect the secretory and base pieces of the striated duct. Intercellular canali are extensions of the lumen of the end base between adjacent secretory cells that serve to increase the luminal surface are available for secretion. Integrated ducts, small ducts into which secretory and basal is are lined by a single layer of flow provided cells and myoepithelial bodies and their processes. Overall diameter is less than secretory and base, but the human is larger than secretory and base. Centrally placed nucleus, little cytoplasm, rough endoplasm, reticulum, and Golgi apparatus. A few secretory granules may be found in the um, cytoplasm. Special cells located near the bases, few microvilli projecting into lumen, joined adjacent cells by apical junction complexes and scattered desmosomes and gap junctions and have fold process that interdigate with similar process of adjacent cells. Long integrated ducts protrude against and shorter submandibular, fully dwelled in the sublingual gland. Function क्या होगा? Channel for salivary flow contributes to the salivary secretion, lysozymes and lactoferrin, observe of undifferentiated cells that may undergo proliferation and differentiation to replace damaged or dying cells in the end pieces and striated ducts. Striated ducts are larger duct into which the integrated ducts empty. Main ductal components in the intertubular portion of the striated duct, the serous and mucus accumbens. Centrally placed spherical nucleus, pale acidophilic cytoplasm. Centrally placed spherical nucleus, pale acidophilic cytoplasm. Basal striations are perpendicular to the base of the cells. Mitochondria are lying in cytoplasmic partitions produced by the enfoldings of the basal plasma membrane. Thus, endoplasmic reticulum and Golgi apparatus and few secretory granules and sites um, uh, of the caniculi. Short stubby microvilli at the luminal surface, joined adjacent cells by junctional complexes and tight junction but lack gap junctions. Functions क्या होगा? Modify the salivary secretions, changes from isotonic to hypertonic, sodium resorption and calcium and potassium excretion. ठीक है फंक्शन क्या होगा मॉडिफाई द स्लाइवरी सेक्रेशंस ठीक है चेंजेस फ्रॉम आइसोटोनिक और हाइपोटोनिक एंड सोडियम क्या होगा री एब्जॉर्प्शन होगी और पोटेशियम की क्या होगी एक्सक्रीशन होगी टर्मिनल एस्क्रेटरी डक्ट्स थ्री टाइप्स ऑफ कॉमन डक्ट्स बताया ठीक है स्टेरिएटेड डक्ट्स इंटीग्रेटेड डक्ट्स एंड टर्मिनल excretory ducts as the striated ducts leave the individual glandular lobules and enter the interlobular connective tissue. They join to form the excretory duct. The main excretory duct, this is the excretory ducts, striated ducts, intercalated ducts, caniculus caniculus between cells, tubular secretory and bases, base, and spherical secretory and pale. Larger than striated ducts, main excretory ducts leading from the gland to the oral cavity is formed by the continued confluences of the ducts. The striated ducts, they are lined by pseudo-striated with the columnar cells and mixed with the small basal cells and goblet cells. The smaller duct join to form the larger ducts. As they approach oral cavity, epithelium changes to a sterified epithelium. Functions modify the final saliva by altering its electrolyte concentrations. Connective tissue capsule demarcate the gland from adjacent structures. Septa divide gland into lobes and lobules, carry the nerves and blood vessels and excretory ducts. Fibroblasts, macrophages, dendritic cells, mast cells, plasma cells, adipose tissues. Collagen fibers and elastic fibers along with the glycoproteins and protoglycans. Nerve supply follow the course of vessels, two patterns, intraparietal type and extraparietal type. Intraparietal type axons leaves the nerve bundle, lose its when cells investment, penetrate the basal lamina and form an expanded swelling are very caustic in close contact 10 to 12 nanometer to basolateral membrane are between epithelial cells. For example, submandibular gland and minor salivary gland of lip. Second is the extra parietal type. Axons remain associated with the nerve bundle in the connective tissue 200 to 200 nanometer from epithelial cells. For example, carotid gland. Now, astrology of major salivary gland, uh, carotid gland, all serious. Fat cells may be Cs, ठीक है, fat cells BC, long intercalated ducts are C, ठीक है, long intercalated ducts are C. Submandibular gland consists of serous and pieces and the mucous tubules capped with serous terminals. Serous cells significantly outnumber the mucous cells. Pale staining, pale staining. The intercalated and striated ducts are less numerous than these in carotid but structurally similar. Sublingual salivary gland mixed with the mucocell mode. Integrated ducts are short and difficult to recognize. Intertubular ducts are fewer in number than in the carotid or submandibular glands. Some ducts may be larger in folding the characteristics. In minor salivary gland consists of aggregates of secretory and bases and ducts organized into lobule-like structure in the submucosa or between muscle fibers of the mostly mucus, occasionally ganglions. Salivary control Salivary control efferent pathways, the rate of salivary gland secretions may be affected by three principal factors. Number one is the local factor. Whenever the sensation of taste is stimulated, the salivary flow rate increases. Local factors, the fibers carrying taste sensation pass along the cauda tympani, the lingual nerve, and the glossopharyngeal nerve. Glossopharyngeal nerve stimulation supply the posterior one-third of the tongue, result mainly increased parotid salivary flow. Cauda tympani inputs and outputs appear similarly correlated. Acid stimuli are the most effective salivary flow stimulants. Salt and sweets less so, and bitter the least effective. Olfactory irritants similarly cause increased salivary flow rates. Irritation of the oral mucosa can also result in increased salivation. This feature is most pronounced following new denture or orthodontic appliance insertion. In later instances, increased salivation is usually temporary, although it may initially alarm the patient. Unilateral proprioceptive stimulation in the periodontal ligament, muscles of mastication, or temporomandibular joint predominantly leads to the ipsilateral increased salivary secretion. Emotional psychic stimuli, the sight of food, taking about food, the noise of food preparation are sufficient to activate the conditioned reflexes leading to increased salivator. By contrast, discussion are true thought about this like foods may result in dimension, salivary secretion. Stimulations from other organs, esophageal irritation causes the reflex salivation, although gastric irritation leads to increased the salivation as a component of the nausea vomiting reflex. Central control, the efferent stimuli are finally integrated in the cell bodies of preganglionic secretomotor neurons. The cell bodies of sympathetic nervous system appear to lie in the lateral columns of the first five thoracic nerves, with the salivary spinal reflex centers being influenced by the medulla and higher centers. For example, hypothalamus. The nuclei of the facial and glossopharyngeal nerves contain the cell bodies of the parasympathetic system. This area, the nucleus salivators, comprises neural cluster in the reticular formation extending from the facial nucleus ambiguous. The nucleus salivators has been subdivided into two components. Salivators superior stimulation causes secretion from the epicilateral segment. Nucleus salivators inferior stimulation causes secretion from the ipsilateral parotid gland. पहले क्या था efferent pathway, अब second क्या है efferent pathway. The control of salivation is mainly under parasympathetic control, although there may also be a sympathetic component. Passing through the facial nerve, parasympathetic fibers pass with the chorda tympani to reach the lingual nerve and then synapsing in the small nerves. Short postganglionic fibers pass into the glands. The glossopharyngeal fibers pass through the tympanic and lesser superficial petrosal nerve to reach the aortic ganglion, where they synapse with the postganglionic fibers of the auriculotemporal nerve, which supplies the parotid gland. Autonomic control, the sympathetic fiber synapse in the superior cervical ganglion with postganglionic fibers then passing to all the salivary glands. The parasympathetic postganglionic neurotransmitters is acetylcholine, whereas that of the sympathetic postganglionic terminus in norepinephrine. In addition to salivary secretions, the autonomic nervous system also exerts control over the glandular vasculature. Secretory duct activity, and myoepithelial cells. Neural control of salivary gland function is therefore complex. Now, salivary gland gross anatomy, gross morphology, and their types I can. नेक्स्ट लेक्चर इज द स्लाइवा मोस्ट इम्पॉर्टेंट टॉपिक जो आपके जो जस्ट में क्वेश्चंस जो आते हैं आपके सैविक ग्लैंड में स्लाइवा फंक्शंस स्लाइवा पोजीशन मेनली जो है वो मोस्ट इम्पॉर्टेंट स्लाइवा जी एनी क्वेश्चन एनी क्वेश्चन What are the types of the salivary glands? Salivary glands के जो क्या types हैं? What are the types of salivary gland? This is the parotid gland. The major gland and minor glands. मेजर ग्लैंड्स कौन से हैं और माइनर ग्लैंड्स कौन से हैं? Yes. Major salivary glands and minor salivary glands. Submandibular and sublingual glands is the major glands, and minor minor salivary glands. द टाइप्स ऑफ ड्रग्स, इसमें स्लाइविक ग्लैंड्स में ड्रग्स आपको मैंने बताई हैं, 3 टाइप्स की होती हैं। कौन कौन सी होती हैं? टाइप्स ऑफ ड्रग्स। यस, स्टिमुलेटर्स, रेडिएटर्स एंड इंटीग्रेटेड एंड। आज की जो लेक्चर है, कोई प्रॉब्लम इसमें है? टुमारो स्टार्ट द स्लाइवा, ये जो बहुत इम्पोर्टेंट है। इसमें स्लाइवा में उसकी कंपोजिशन एंड फंक्शंस कर इंशाल्लाह इसको कंप्लीट करेंगे। तो आपकी जो जस्ट के जो पेपर है उसके लिहाज से जो है, ये आपका जो स्लाइवरी ग्लैंड चैप्टर 11 जो है मोस्ट इम्पॉर्टेंट आपकी ये चैप्टर 11 जो है आपके 10 के, और ओरल फिजियोलॉजी की बुक है क्रिस्टोफर लेवाई की बुक, उसमें से मैं सलाइवा उसमें से आपको कवर करवाऊंगी। ये दोनों आपका हिस्टोलॉजी और ओरल फिजियोलॉजी टॉपिक्स दोनों इसी में कवर हो जाएंगे। एनी क्वेश्चन? ओके। आज का जो लेक्चर है इसको आप 10 किट्स में से पढ़ें। आज का जो लेक्चर है, ठीक है, स्लाइवी ग्लैंड का चैप्टर 11 10 किट, ठीक है। और जो कल आपको मैं स्लाइवा पढ़ाऊंगी वो आपका 10 के, और आपकी जो ओरल फिजियोलॉजी की बुक है क्रिस्टोफर लिवाई, उसमें से आपका अप्लाइड ओरल फिजियोलॉजी, ठीक है, उसमें से कवर करवाऊंगी। ये आपके दोनों टॉपिक्स आपके एस्ट्रोलॉजी और ओरल फिजियोलॉजी का दोनों को कवर करेंगे। ओके। ओके, अल्लाह हाफिज। एनी क्वेश्चन? ओके, अल्लाह हाफिज।